Now, the acting Tamale Metropolitan Director of Health, Dr. Hilarious Abewu, has raised concerns over absenteeism among nurses in all 52 health facilities in the metropolis. He said only 1/3 of the staff go to work regularly. He said the sick visit these facilities and there is no one to attend to them.
Speaking on a panel discussion at the 2021 Annual Performance Review meeting of the Tamale Metro Health Directorate on the theme Improving the Quality of Routine Service in the midst of COVID-19 pandemic, the role of effective human resource management in the Tamale metropolis, Dr. Abewu cited a health facility only 18 out of the 60 health workers attend work regularly.
Generally, only about a third of the people who are on our payroll come to work regularly. In one of our healthcare centers, we had about 60 staff on duty, on roll. If you do an analysis of the attendance, it's only about 18 people that come to work regularly, which means the rest, 32, virtually don't show up at work, but they get paid every month. The situation is very similar across all the healthcare centers. It is time, therefore, for all of us to put our heads together to address these challenges so that we can all be assured that should any of us develop an emergency here in this room and rush to any of our healthcare facilities, our facilities will not be the reasons why we die prematurely.
The health director for the Kumbungu district, Dr. Barkisu Seidu, attributed some of the challenges the health sector in the region is facing to what she described as poor job description.
How many of us here have been oriented on work, or have been given some orientation about transfer, posting, even the very work you do you have any job description? Who received this appointment letter with a job description? So sometimes that is where the problem comes in. You fit into the system and you observe there are so many wrong. So we've seen so many wrong things happening so much that we think that is a norm. And so anytime a manager fails to grant it, the manager is being seen as being very wicked or does not want to comply. I've heard a lot of names. The manager seems to be very, very difficult. But sometimes when you engage even the very staff and you try to explain to them some of these issues, they begin to understand you. But then there are millions of others. If our own staff do not even understand these policies, how do we expect other stakeholders to understand this?
The health director for the Tolong district, Dr. Osman Seidu, raised concerns over maldistribution of staff, which he attributed to interference from politicians and traditional authorities.
The only problem is there is maldistribution. And these are some of the reasons why there is maldistribution. There is serious interference from our traditional leaders and also our politicians too. And the third thing is, we're within our own selves. We have conflict of interest.